you a little bit of background on Alzheimer's Scotland to start with. So in Scotland, I mean, some of you will be aware of these figures, 93,000 people living with a diagnosis of dementia currently, over 3,000 of them under the age of 65, and that's estimated to go up, as we know. So around 20,000 new cases diagnosed each year. Alzheimer's Scotland are the leading provider of support to people living with dementia. We have 20 resource centres across Scotland. Not quite 600 staff, just between 500 and 600, and 900 volunteers. So it's quite an interesting dynamic in the organisation between the staff and the volunteers. 20 resource centres. Not everyone's going to get to a resource centre. Not everyone wants to come into a resource centre. How are we going to reach these other people? Huge challenges. How do we get to these 93,000 people? And by the way, that's people living with dementia, so you get 93,000 partners, sons, daughters. We're supporting all of these people. Our motto is that no one should go through dementia alone. So we're working with everyone who's living the experience. But there's unprecedented opportunities for autonomous living. You know, I'm a real believer that, you know, this is a time of great opportunity. But also, I wanted to flag something to you, just from an event I was at, the event we were at last week. So was it last week, the week before? And if you haven't got this excellent document by Donald McCaskill from Scottish Care, do get it. Alzheimer's Scotland are quoted in it, happily. A human rights-based approach, that's where we're coming from. Look at the ethics. Everything that we do in Alzheimer's Scotland has this human rights-based approach. It's people first. People are why we do everything. And with that in mind, I'm going to let you have a wee 6 minutes clip just to put you in the picture of what we're doing. Hopefully this works.
Laura is 72 years old and was diagnosed with Alzheimer's 2 years ago. She lives with her 74-year-old husband Carl on the outskirts of Glasgow, and he is her main carer. Laura also has a mild form of COPD, which sometimes makes it hard for her to catch her breath when the weather is cold. Carl is in good health, and although Laura is not that advanced on her journey with dementia, he still finds that it has impacted on their socialising, and they see far fewer friends than they used to.
Laura's daughter gave her a tablet last Christmas and had spent quite a bit of time with her, showing her how to use it, including connecting it to her new home Wi-Fi. She prefers it to her smartphone, as the screen is much larger, as are the keys on the touch keypad. She has the Alzcott app on it and uses it regularly to see what is going on with regard to activities in her local area. She can also access the helpline 24/7 from her tablet using Attend Anywhere, which her daughter's friend Sally showed her how to use. Sometimes late at night, she has used it to have video calls with the people at Alzcott, who have reassured her when she feels confused and scared.
She has also used Attend Anywhere for regular weekly therapy sessions with Alzcott, where she learns mindfulness and meditation. This is covered by the direct payment she receives as part of self-directed support. At a recent session in the Dementia Resource Centre, she was shown how to use a couple of very helpful apps which help her with her breathing and managing her COPD. There are also apps that help her to remember things and track how she is coping with her dementia. All of these are in the Alzcott apps library with helpful ratings and summaries of what the apps do. When she downloaded the apps, she consented to share all of her data with Alzcott, as she is a very strong advocate for the research that they fund. Alzcott now receives all the data that she logs on a regular basis and sends it to the Scottish Dementia Informatics platform, where it is used to populate new predictive models that are being developed and tested. One of the sections of the app that Laura noticed when she started using it was on befriending. While she loved to spend time with Carl, she also used to like chatting to her girlfriends, few of whom she saw anymore. So she signed up for the service and was delighted some weeks later to be matched with Julie, a woman 5 years younger than her, who shared many of her interests. They now go out once a week to the shops for a coffee and chat about everything and anything. This also gives Carl a chance to have some time for himself, which he enjoys. Laura recently joined a Dementia Circle group and was interested to see lots of gadgets being demonstrated. She was keen to have something that stopped her losing her mobile phone, and the leader of the session told her about a small sticker that would allow her to track it using her tablet. In fact, they showed her the Alzheimer Scotland website, where there was a catalogue of all of these sorts of products with user reviews and ratings, and videos to show you how to use them. She could buy the tracking sticker off of the website, and it arrived 2 days later. Laura signed up on the Alzheimer Scotland website to receive news on the latest research and was invited to take part in a clinical study, which after discussing with Carl, she decided to take part in. She was interested to see how the research was done, and it was another good opportunity to meet people in a similar situation to her. Part of the research involved tracking her performance in memory tests on her tablet. Unfortunately, when using it the other day, Laura had done something which caused it to crash, and neither her nor Carl had managed to get it working again. Luckily, she knew that she could take it to one of the regular Geek Squad sessions at her local DRC, where they answered any technology questions you had and could help you use your digital devices if you were struggling. In 5 minutes, the nice lady at the desk had got her tablet working again, and Laura was able to use it. One of the things that the Geek Squad person had suggested to her and Carl was that they try out something they called digital recipes. This involved the blending of 2 or more apps with some very interesting results. So, for Laura, because her breathing was more difficult when the temperature dropped below 4 degrees centigrade, a recipe was created that looked at the weather forecast and alerted her if it was likely to be colder than that the next day. Laura also doesn't like the dark, so a recipe was created for her that sent her a reminder every day just before sunset so she could make sure her lights were turned on. Laura was so interested in this new idea of using apps that she agreed to help out at what the Geek Squad women called a hackathon. Basically, a bunch of people developing helpful apps would test their ideas out on her, then develop something quickly for her to look at and comment on, and then iterate the app with her input. Occasionally, Laura still went out on her own without Carl. She had a couple of helpful apps on her phone in case she ran into trouble and couldn't get hold of Carl. The first was Purple Alert, which, as well as being used to help find people with dementia, could also be used by people like her if they felt that they were lost. There was a panic button that she could press that then connected her to the council's monitoring centre, and they knew exactly where she was from her phone signal. The second app was AR Find, which used augmented reality to help her find her way home. For example, if she pointed her phone at the large sticker on the bus shelter, it would tell her either the right bus to take to get home and when the next one was expected, or how long it would take to walk home. If she chose to walk, it would immediately take her to Google Maps with step-by-step directions for her.
Okay, so great. Laura and Carol are in receipt of lots of support from Alzheimer Scotland, very well connected in. I don't know if anyone could spot the obvious there. This is a 2021 vision. This is aspirational. We are doing some, but not all of this at the moment. But it's a kind of aspiration of where we want to be, how we want to support people. You know, the minute we're in contact with someone, if there's an opportunity to build on that, to have a more personal solution for them, then we want to be there at that point. Any data we collect, we want to maximise on that, to signpost them to other things that are of use within Alzheimer Scotland and also with other organisations and within health. So it's about making sure that the data we capture now is actually going to be useful. I know we don't do anything with it, we don't know what we're doing with it. You know, we've got all this information kicking about in Alzheimer Scotland and the usual panic over GDPR and, you know, and what are we doing? You know, why we're doing it is for people living with dementia. We're doing it to make outcomes better for them, not so that we know we've got 900 volunteers and 500 members of staff. That's not the point at all. So what has been really useful is looking at these kind of aspirational stories of the future and thinking about, well, how could we make use of that data? What could we be doing? You know, we can't open resource centres in every town in Scotland. We need to be online, we need to be digital. So this sort of aspiration to be digital first has been led by Clive Flashman, who I've been working with. So he's the Director of Strategy at Orca and the President of the Digital Health Council at the Royal Society of Medicine. He's a good egg, he's got a really good head for health and data and things that within our organisation we don't have the expertise. So he has been supporting us and we now have a digital strategy. The rest of the team, well, there's me and there's Gillian, who some of you will have met. We have Charlotte, Tommy, and our benevolent leader, Joyce, who I refer to as the mixologist, because I have to credit her with having really good skills at building a team, at getting people together with different skills who have kind of supercharged what we're doing. And the digital strategy has given us the vehicle to take this forward within the organisation. To backtrack slightly, this all started with our technology charter for people living with dementia, and it's a rights-based approach. It's saying that if there are digital solutions out there, then people with dementia and their carers have the right to access them. They have the right to good information, to have informed consent, to know about the ethical concerns. So it's all in here, and as I say, it's quoted in this new document, which is just brilliant, I have to say. And this has been the vehicle for our work. So 2 years ago, Scottish Government Technology Enabled Care Fund funded all our posts, not Joyce's, funded our posts as senior technology coordinators. We are now being mainstreamed and brought into Alzheimer Scotland as digital leads, because the work we have done has had such impact. We did a national learning programme. That was really a remit from the 2 years government work, and we've had 1,000 delegates through that learning programme. And that was about building the skills so that people who talk to our service users can have those informed conversations, can say, all right, what is that you're doing in your iPad? Have you tried doing this? Have you thought about doing that? People we have found are quite reticent about giving out information because they feel they don't have the skills to talk about it confidently, or they don't want to endorse certain products or services. So we've had a programme where we've run days. We've had manufacturers in the room, we've had people living with dementia and carers in the room, and they've talked about their experiences, they've talked about what they are doing, and we've had practitioners from health and social care, social care, third sector, housing, NHS, our own Alzheimer Scotland staff, and we've had them, listen to these user experiences and also trying technology, getting hands-on, putting technology products on the table, having a look at them. How is this going to support me in the work that I do? How can I talk to someone about that? How can I improve their outcomes for them? Something that's just happening at the minute is we had looked at a Wive. I don't know if anyone's come across Wive. It's a heart rate monitor. We now have a relationship with the Health Board in Shetland, where they are looking at this heart rate monitor to speed up the kind of diagnosis process for dementia. They're finding the people there when they are looking to have a diagnosis and maybe be given a drug that might support that. It's taken months to get to that point, and it's because they can't get access to an appointment to go and get their heart rate checked out. So this small monitoring mobile device is now being tried to speed up the process. And I just think it's an amazing application of technology, that such a small wee thing could make this massive difference to people to speed up that process. Anyway, that's a wee aside, because I only found out about that the other day. My colleague Charlotte's leading on that. So, testimonials from people who have been through our programme. There's huge demand. We were asked to have 400 people go through this. We're at over 1,000. We're not even at the end of our 2 years yet. There's massive demand. People do want to be talking about technology. They do understand that there is a drive towards this. But you know, I was talking to my table about the fact that I have colleagues who are sitting in resource centres supporting people, and the 5 minutes, right? Okay. So they have a link worker post that is funded jointly between the NHS and Alzheimer Scotland. What they're having to do is go to an NHS office, sit at an NHS table, at an NHS computer when they're on their NHS days, and then back to the resource centre or out to visit people in their homes. And it's just the most frustrating system. And when you say to them, well, you know, Jeff Huggins is going to make us all connected, we're all going to talk to each other, it's all going to be lovely, it's brilliant. You know, Clive's from London, he's got a digital strategy, look at what we're going to be doing. They go, really? Are you kidding? But it is, you know, we have to have these conversations, we have to build confidence in the workforce. It's been quite a hard sell for us. You know, not least with people on the ground, but also with our executive board, convincing them that digital is the way forward. We work with people with dementia. You know, we want people to talk to people, not technology, but technology is only the enabler. It's just the bit in between. So this is a hugely important part of the work that we do. This is the Dementia Cycle. So about 6 years ago, when I started with Alzheimer Scotland, I worked with a small team. We were kind of service design type folk who had been through Glasgow School of Art, and Joyce, who I said is just really visionary in what she does with Alzheimer Scotland, got us in and got us to work on really amazing things like the Dementia Dog Project, which we have now sold off to Alzheimer's in Australia. So we have got dogs supporting people with dementia in Scotland and Australia. The Dementia Circle methodologies, the protocols, they're all around peer-authored reviews. So people living the experience, telling us what works for them, what products, what services they are using, and what they think about them. So you can go onto our website and you can see what someone's thought about, let's say, a clock. Okay, so the £100 Claremont clock did this, this, and this. The £10 Tesco one did all that as well. You know, think about the Aldi advert. You know, the £10 one did the same as the £100 one, so what are you going to buy? And it's not me saying it, it's not me endorsing the manufacturer, it's our service users, it's citizens saying it. So you know, what better way to find information? So if you're looking for really good information about technology products, go to Dementia Circle, and if we haven't looked at it, we might. We run groups across the country, and we display the kind of output of these products on our pods and tods, products on display and technology on display. They're in our resource centres. Our resource centres, by the way, are moving towards becoming digital resource centres. So not only can you go in and experience digital, you can experience monitoring solutions, ring doorbells, whatever, all the way through the centres, but you can also experience it mirrored on the Dementia Circle. That's something that we're working towards. So we're doing validation, you know, the testing of the products. We're looking towards maybe a kite marking system for dementia-friendly products. We're testing them, we're looking at interiors, our resource centres, our live test beds for dementia-friendly environments. The training is our learning project. There's an awful lot to say around Dementia Circle, but it's a vast resource. And if you go onto the site, you'll find this. You'll find a suite of information, the leaflets I think I've left over there. Do go on and have a look round. Right up to date just now, we're talking about digital high street. You know that I didn't have any pictures of cats and dogs, but I did of the Bake Off team, so so these digital recipes, you know, we've got all these buzzwords now, it's like really exciting. What are we going to do? We've got this high street where people can make up their own digital care plan. So at the point of diagnosis, we want people to do their sort of participatory care plan, their digital care plan. What do they want in the future? Maybe they don't want any of it, that's okay. But let's at least be informed and confident enough to have those conversations and let them know what's out there. Remember, the people of dementia tomorrow are going to be the people, you know, they're going to be us. And, you know, we're all using smartphones and, you know, we're all switched on to it. So huge opportunities for us. You heard about the Purple Alert app, so that is something that we developed. We're also working with a developer on a Copy Health app, something else that we're involved in. There's masses going on. I'll stop there because that's probably enough to say, but I hope that is of some use.
Yeah, absolutely.